I think in terms of providing quality healthcare access for the people that I serve, it's going to start with having some very real conversations about our current healthcare programs. Medicaid right now, the reason why you don't see a lot of primary care physicians taking on a lot of Medicaid patients is simply the reimbursement's too low. They can't make, it's not an affordable model. And so we need to start having a conversation about what it actually takes to provide health care to these impoverished communities.
It's financially impossible, difficult if not impossible, for the overwhelming majority of family physicians to practice in that area because they have bills like everybody.
Colorado does not have enough physicians in underserved areas and in rural communities. And so, we need to figure out how we incentivize more medical students to go into primary care and to make sure that we have, an ample supply of doctors to serve.
How do we get more physicians to go into these settings where they are not reimbursed, they have huge debts and are not reimbursed at the rate that they could pay these back? It's going to take a vision that is different than we've had politically in the past.
They are providing a very much needed service right now. But in terms of actually being able to have physicians in that area, we need to start looking at how we can increase the reimbursement rates for Medicaid and other programs that the government reimburses. Incentivizing, primary care in rural areas or in underserved communities, I think is very much a conversation that the Colorado legislature does need to have. I'm not so sure that we're always willing to have the conversation because it's a very large problem and it's a systemic problem, and the answers to those problems aren't always easy.
So are there enough family care, primary care physicians in Colorado to take care of the need for all these uninsured and underinsured people? The answer is no. It's just plain and simple. There's especially evident in a couple areas. The rural areas are just devastated. They just cannot attract primary care physicians, and the rural areas especially built for a family style physician who can do pediatrics, do obstetrics, do minor surgeries, and adult care as well. And then, of course, the other areas in the urban areas, the poor communities in the underserved areas and the uninsured. Primary care physicians are becoming a dying breed.